South Africa is regarded as one of the tuberculosis hotspots in the world. The World Health Organization estimates that in 2022, 280,000 people fell ill with TB in the country. According to WHO, South Africa is one of 30 countries identified as contributing to more than 80% of estimated cases worldwide. And the organization says it is one of 10 countries where there is a high TB rate, a high TB and HIV co-infection, and a high number of people living with multi-drug resistant TB. Scientists believe more needs to be done about malnutrition, as this is said to be an impediment to curbing the spread of the disease.
Nutrition is like a vaccine. And while we're looking for a vaccine, especially for adolescents and adults, to complement the vaccine we currently have for children called BCG, I think that nutrition can play a big role in decreasing the incidence of TB in our country. If you live in overcrowded housing, if you don't have enough food to eat, you are more susceptible to contracting TB and to getting TB disease. And of course, if you get the disease, then you're going to be also able to spread it to other people. So by preventing TB, we are both preventing people from getting sick and having to come to the hospital or the clinic, and also dying, because we know that if you don't treat TB over time, you can die from TB. Now, TB seems to attract undernourished people far more. So for those undernourished people with a what's called a BMI, and it's measured by weight and height, if you got something under 18, then you should be getting a food supplement if you present at a clinic, especially if you have TB.
The conference brings together policymakers, academics, researchers, and members of civil society. The objective is to call on all sectors of society to join hands to reduce new TB infections and deaths by 2030.
There's other risk groups that are not accessing TB prevention therapy, especially family members of a person with TB. They do not come forth to the hospitals or clinics to get that TB prevention. Only 6% of contacts are currently on TB prevention therapy. So we need more work to encourage those people that have been in contact with somebody recently diagnosed with TB to present to the health facilities to request treatment for TB prevention.
Scientists also made a call for the health and social development departments to be joined to assist in fighting diseases. Melinda, SABC News, Durban.